Assalamu alaikum. Let me welcome you on behalf of Ahsan Academy on the presentation of the Mediastinum. Let us fix the objective. First I'll discuss the general aspects of the Mediastinum, then we'll consider the divisions and boundaries of common and separately, the contents and relative position of the structures present within it, and at every stage we will try to correlate clinically. These two figures are viewed from the anterior aspects, and you can see the lung on either side and the heart at the center. You see the lung is covered by the two layers of pleura. The visceral pleura tightly adherent to the lung, but parietal pleura are separated by potential space. You can see the cut margin of the parietal pleura. So parietal pleura that covers the inner side is the mediastinal pleura. So you can see a part of the thoracic cavity lies between this mediastinal pleura. This is the cut ends shown by the label arrow. So this small space between the pleura is the mediastinum. So we can define mediastinum as the part of the thoracic cavity that lies between the mediastinal pleura. It lies behind the sternum and anterior to the thoracic part of the vertebral column. So let me show you the area by changing the color. The color has been changed and mediastinum is labeled. Let us consider the boundary. Anteriorly, you can see a bone, that is the flat bone is the sternum, that makes the anterior boundary of the mediastinum. Posteriorly, you can see the vertebral column extending from thoracic 1 to thoracic 12. So this vertebral column makes the posterior boundary of the mediastinum, and laterally already we have seen the mediastinal pleura. This extends vertically from the inlet, that is the superior thoracic aperture formed by the upper part of the manubrium sterni, first rib and first thoracic vertebra, and it extends down up to the diaphragm. This is central tendon of the diaphragm, tendinous part. This mediastinum so communicates above and inferiorly. The superiorly the structures are continuous between the neck and the mediastinum. This inferiorly, through some opening, the mediastinum is connected to the extraperitoneal space of the abdomen. It is continuous as it is outside the parietal peritoneum, so extrapleural space is continuous with this mediastinum. Extradural space means outside the dura mater, that is present within the vertebral canal, and this outside space outside the dura mater communicates with the mediastinum through intervertebral foramen. You can see the figure above and to the left, the vertebral column on either side has intervertebral foramen. You can see the photographs of the upper right one. A plane is shown that passes through the sternal angle, means it is the plane that is transverse in nature, passing through the junction between the manubrium sterni and the body's manubriosternal joint. So it will pass through the intervertebral disc between the fourth and fifth thoracic vertebra. So this plane dividing the mediastinum part above and part below. So the part above is known as superior mediastinum and the part below is known as inferior mediastinum. So you can see this superior mediastinum lies behind the manubrium sternum, and inferior mediastinum lies behind the rest of the body of the sternum. The inferior mediastinum is again divided into anterior, middle, and posterior mediastinum. We will consider each mediastinum separately. So superior mediastinum has some boundary. You can see the photograph. The mediastinum pleura is there. So in between there is a gap which containing the heart and red vessel. This is the mediastinum. So the part behind the manubrium sternum is the superior mediastinum. This stained area is the superior mediastinum. So this is behind the manubrium sternum and anterior to the upper fourth thoracic vertebral column. Upper thoracic vertebral column that contains upper fourth thoracic vertebrae. Laterally, naturally, the mediastinum pleura is there, and above it is the horizontal plane. Below the horizontal plane passing through the sternal angle, and above it is the plane passing through the inlet, that is also known as the superior thoracic aperture. So this area is the superior mediastinum. Superior mediastinum contains some important structure that passes from and to the heart. So let us show the structures in the diagram. The main structures include the arch of the aorta, that is indicated by a line. The arch of the aorta gives some branches. This is brachiocephalic artery. This one is the left common carotid artery, and this is left subclavian artery. So arch of the aorta, along with its three branches that arise from the convex surface, are the content first. Then this is the left brachiocephalic vein. This one is the right brachiocephalic vein. So these two combines together to make the superior vena cava, who is in the superior mediastinum. Now one tube, this is the tube, black arrow is showing. This is trachea, who is descending from the neck, and this is the esophagus that is lying behind the trachea and descends from the neck to the abdomen. Important nerves crosses this area, the right vagus and the left vagus, and left recurrent laryngeal nerves lies in between blood vessels. Some are in front of the blood vessels. Thymus is present in the younger age, who gradually become smaller. So younger age will get the anterior part is occupied by the thymus, who become rudimentary in the adult. Some lymph nodes are present all over the areas. Thoracic duct on the posterior wall and azygos vein on the posterior thoracic wall. So these are the contents of the superior mediastinum. The inferior mediastinum, already we have discussed, is divided into anterior, middle, and posterior. As a whole, if we consider the boundaries, it is behind the body of the sternum. It is in front of the thoracic vertebral column that contains 5th to 12th thoracic vertebrae. On either side, mediastinal pleura is there, and it is bounded superiorly. Actually, it is lying inferior to the horizontal plane passing through the sternal angle, and it is on the central part of the diaphragm. This is tendinous part known as central tendon. This is the as a whole boundary of the inferior mediastinum. You can see from transverse section and from median section the position of the inferior mediastinum and divisions of the inferior mediastinum. You can see the heart, it occupies an important area, most of the area of the inferior mediastinum, and a very small anterior part is there, and relatively larger posterior part is there. So it is divided into anterior mediastinum, middle mediastinum, and posterior mediastinum. The middle mediastinum contains the heart and its covering. So anterior mediastinum is in front of the pericardium, and posterior mediastinum is behind the pericardium, who is the covering of heart. This is the anterior mediastinum shown by green stain. This is the middle mediastinum shown by bluish stain, and this is the posterior mediastinum shown by red stain. So anterior mediastinum lies between the sternal body and the anterior part of the pericardium. This is fibrous pericardium, and it contains the sternopericardial ligaments. Is a fibrous band extending from the anterior part of the pericardium to the sternal body. A few lymph nodes are present in it. Internal thoracic artery divides and it gives the mediastinal branches in this anterior mediastinum. Thymus, and it is more prominent in the younger age, and gradually it degenerates, so it is withdrawn from the anterior mediastinum with the increase of age. So loose connective tissue is present in rest of the areas and fill up the areas. Now middle mediastinum is the largest part of the inferior mediastinum. This part is bounded anteriorly and posteriorly by the pericardium, and it contains the heart with the pericardium. And from the heart, the ascending aorta arises and ends at the level of its upper limit to become the arch of the aorta. The two vena cava, superior vena cava as well as terminal part of the inferior vena cava is present here. The trachea descends, and at the level of the lower part of the superior mediastinum, it divides into two principal bronchus. So this bifurcation projects into the middle mediastinum. The pulmonary trunks passes from the heart to the lung. Phrenic nerve crosses, and it is accompanied by the phrenic vessels. The cardiac plexus of the nerve and some lymph nodes are present in this middle mediastinum. Posterior mediastinum is the component of the inferior mediastinum. It's relatively longer and larger than the anterior one, but it is narrower than the middle one. It's clinically important as it lies behind the heart, bifurcation of the trachea and pulmonary vessels. Actually, that part of the heart is covered by the pericardium, so it lies behind the pericardium, which is very close to in contact with the heart. The bodies of 5th to 12th thoracic vertebra is the posterior boundary. Posterior mediastinum is important because of its content and relation with the heart. You can see some photographs which will give an idea about the contents. Let me list the contents. This is the descending thoracic aorta, which is branches. You can see the red color descending thoracic aorta in different figures present in the lower part. The esophagus is relatively less red tube, muscular tube that crosses the arch of the aorta behind and descends. The middle two figures are seen from the behind, and the two figures on the sides are viewed from the anterior aspects. The azygos vein and the hemiazygos vein are pasted on the posterior thoracic wall. The thoracic duct also ascends following the posterior thoracic wall. The sympathetic chain and thoracic splanchnic nerves also close to the posterior thoracic wall. A vagus nerve descends on either side, and lymph nodes are present all over, especially accumulates near the root of the lung. Thank you very much for staying with the presentation.